Okay, Doki. Yes, I know. Say Chief, this time I'll see you guys on Monday. But me, I told you guys for sure. Say I will see you now by 8:30 because I know. Say me and Dr. Barth, unless otherwise, don't go carry last on top the Health Matta. Especially now, we be say we see some very sad videos, pictures of how people are being treated as regards to cholera. I mean, I saw some very gory pictures during the week. You know, saw people on the floor receiving treatment. I saw some persons on wood, you know, trying to receive treatment for cholera. And I just try to understand or ask myself, say, how we been take reach this stage? Like, wetin been cause this outbreak? What were we doing right that we stopped doing? Or wetin be those things that we got start to do to make sure, say, we reduce them? Because right now, of course, cholera don't pass half of the states within Nigeria. I mean, we've got 36 states and over 20 states now don't they affected with cholera. We started this last week, Saturday. Of course, Dr. Babi started the topic last week, Saturday, the resurgence of cholera outbreak. And we definitely could continue because I know, say, it's still something that is trendy. So, ladies and gentlemen, my name is Nastimity. You don't top your #1 family entertainment channel. As always, my doctor is looking elegantly dressed. And I know, say, they're extremely anxious to talk about waiting we've been stopped with last week. Dr. Barth.
Good morning.
Good morning, sir. As much as I am laughing, definitely is not something
Thank you for your kind words.
Yes, sir.
You're looking sweet as always.
As always, you look good yourself.
Thank you. And on that note, I want to say a big good morning to our viewers at home and around the world. This morning, we're happy to be back on Health Matta, your weekly, regular TV show on health. Today, we'll be looking at a topic we started just last week, okay? The resurgence of cholera. Last week, we dwelled on the history of cholera. Well, this week, we'll be looking at more practical terms with respect to what we can do to reduce the number of mortality we have in our environment. Okay, so essentially, to create awareness on this deadly disease, but yet highly preventable, that is killing a whole lot of us at this moment. As of last week, we're talking about 800 and something deaths, but by this morning, I can tell you that going by the last reported data that we have from NCDC, as of week 31, a total of 1,178 people have died in Nigeria as a result of the recent outbreak of cholera that actually started at the beginning of this year. And you can agree with me that it's killing much more than COVID-19. Against the backdrop of having the Delta variant also ravaging globally, including, of course, our own dear country. So it becomes a double whammy. So we need to be at our best. On that note, I want to try and make a definition so that we can understand. We'll be talking on today's topic, number one, the definition, what is cholera all about, overview. We'll be talking about the symptoms that this disease can present with. Of course, the causes, how one can get infected with cholera. And then we'll look at the risk factors, complications that can occur. And then if we have all the time, we'll go all the way down to treatment. Now, what is cholera? Cholera is an acute diarrhea disease that is caused by eating or drinking contaminated food or water. The contamination could be by just one bacterium known as Vibrio cholerae. I want to take that again, an acute diarrhea disease caused by drinking water or ingestion of food that has been contaminated by a bacterium known as Vibrio cholerae. This infection can actually manifest as early as 5 hours after getting exposed to such a pathogen. 5 hours to about 5 days. And it is not everybody who gets infected that will actually come down with the disease. only 1% of people who get infected will come down with the disease. However, the rest that may not be able to come down with the disease may have little or no disease, little or no challenge. But the danger there is that this set of people have the capacity and the potential to infect others, because they will keep shedding the pathogens in their stool for a period of 1 to 14 days. That is for people who did not suffer any form of illness as a result of being infected. So what that means is that some of us who are seated and probably watching this show may be infected. The only difference is that we may not be manifesting any symptoms, and yet we have the capacity to infect others in our environment. Okay? Now, I can tell you that one of the major sources of infection is contamination of water bodies. We'll look at that. But I also want to say that as of today, the data I gathered from WHO shows that about 12% of the world's population still practice open defecation. And we still have that in a number of our states in Nigeria today. And of course, we should not also lose the sight of the fact that cholera is almost a forgotten issue in industrialized nations of the world. So it's only in developing countries that this is still a big challenge. Yeah. It is estimated that about 1.3 to 4 million people get infected with cholera every year, and it causes between 23,000 to 120,000 deaths annually. That figure is from WHO. Okay? On yearly basis, about 1.3 to 4 million people get infected with cholera on yearly basis, and it causes in the neighborhood of 21 to 143,000 deaths on a global scale. Now, talking about the causes, the main cause of cholera is a bacterium known as Vibrio cholerae. There are about 140 different serotypes of this Vibrio cholerae, but only 2 of them have been identified or known to cause disease in humans. And of course, this is serotype 01 and serotype 0139. These are the only toxigenic, the only serotypes that have the capacity to produce toxins when they enter the human cells. Okay, so that's why I use the word toxigenic. And these are the only ones that can cause disease in human. What are the symptoms that this can present with? People who come down with the disease may present with, number 1, nausea and vomiting. They may present with diarrhea, which of course is the principal symptom that can be found in such individuals. Diarrhea on its own, if not urgently tackled by way of replacement, fluid replacement or rehydration, can also give rise to a number of other symptoms, which include loss of electrolytes that can lead to electrolyte imbalance in the body. And this electrolyte imbalance has some far-reaching health complications that can occur. For instance, the minerals that are found in the body that are useful for the normal functioning of the human system. Good examples include potassium. People who are losing fluids by way of stooling may come down with hypokalemia, low serum potassium, which can disturb the heart beating in such an individual and can sometimes cause death. Apart from the electrolyte imbalance that could occur as a result of severe dehydration, you could also have muscle cramps. Loss of fluids on its own can actually give rise to shock. When an individual goes into what we refer to as hypovolemic shock, in which case such individual may be presenting with cold, clammy extremities. The hands and legs will be so cold. If you have anybody who is stooling and vomiting that begins to present with that, such a person should be evacuated with speed to the nearest hospital. If urgent help does not arrive, the person may not be able to survive. And that, of course, accounts for the reason why we are seeing a lot of fatalities in this part of the world. At the moment, the case fatality we have in Nigeria is about 3 to 1% in some states. So it's actually killing and killing a lot of people. What are the causes of cholera? We have talked about the fact that the major cause of cholera is a type of bacterium known as Vibrio cholerae. And what are the places where we can find this bacterium? We can find this bacterium on surface waters as well as well waters. We can find them in seafood. Yes, people that consume seafood that are poorly or partially cooked are at risk of picking this infection. We can also find them on raw fruits and vegetables. A good number of us usually take to drinking some of the supplements like the smoothies that we usually consume. Salads, anything that is not cooked, anything that you cannot prepare by yourself at home, you should at this time make an attempt to avoid. Now, because these are the sources through which you can get infected with cholera. Of course, grains too can be a source of infection. Oftentimes, what happens is because of the open defecation that is found in some environments, in some of our urban cities as well, our sewages in some homes are channeled into the gutter. And anytime it rains heavily and there is flooding, these are pushed not just into people's living homes, into some farmlands. And at the end of the day, we'll go back to those farmlands and harvest those fruits and vegetables and bring to the market. Some of them are not properly washed. So at this time, you should resort to those fruits that you can wash yourself and peel, especially those ones that you can afford to peel, like banana or coconut. Okay, those ones are safer. Other than that, ensure that anything you're eating at this time must be served, must be well cooked, and of course, served hot. Because these are some of the avenues through which we get infected on a daily basis without knowing. You never can tell. You may be among the people that may come down with the disease. Keep in mind, like I said earlier, it's not everybody who gets infected who come down the disease, but the capacity to infect and keep polluting the environment lies even with those ones that look apparently normal. Okay? So that is a big, big challenge. And of course, what are the risk factors? What are the risk factors for cholera infection? I want to mention at this point that there is an acronym called WASH. W-A-S-H. W-A means water access. S, sanitation. H, hygiene. Now, this WASH acronym, WHO and a number of partners have actually developed it into a system that has been adopted in a number of countries in trying to curb and prevent waterborne diseases generally, not just cholera. If you have good access to clean water or potable water that you can drink, that, of course, is one of the ways through which we can prevent getting this deadly and yet highly preventable disease.
And it saddens my heart, doctor, because the truth is, if you get something, at least you know that, okay, I have what it takes to fight it. You know, it's once you know say you get a problem, you don't really get the solution to the problem. But imagine you carrying it, being infected and not knowing, then you can't transmit that to innocent people we no get it. But then I'm trying to ask.
Asymptomatic.
Hey, it's crazy. But then, Dr. I want to know, like, really, for those persons we know when no they, you know, they know they show say they get, because this is not like the first time we're going to talk about people that are carrying one or two things and they will not even know. They will not go there affected, but innocent persons will be suffering from it. So really, what is actually responsible? Is it that these persons, this set of people, they get very good immune, I don't know, are they immune, or their body system will just be that strong not to be able to develop symptoms? I don't know really what is responsible for all of these persons. We know they agree come down with the symptoms, but get others infected.
Okay, thank you very much. I want to make an attempt to answer that question. Number one is that it is a generally known fact that if you have a robust immunity,
okay,
your body system will be able to ward off infections. Okay, if you have a robust immune system, your body system will be able to ward off a number of infections. Unlike people who may not be that privileged, talking about people that have comorbidities,
okay,
like hypertension, diabetes, people living with HIV/AIDS, and people who are asthmatic, people who have all sorts of chronic illnesses. They serve as baggages. So if you get infected, not just with cholera that we are talking about, it predisposes such people at a higher risk of having a worse outcome should they be infected with things like cholera and, of course, COVID-19 as well. Okay, so these are some of the things. But we're going to talk about the risk factors, because part of the things I have on risk factors will answer some.
okay, my question.
Yes, your question.
Okay, so just before you go on, you know, when you're talking about symptoms, you mentioned nausea and vomiting. Really, I want to know the difference between the two, because I think most times we tend to use them together. So
nausea, when you say someone is nauseated, it means the person has a feeling of wanting to vomit. Okay, the feeling oftentimes may, but not in all cases.
Okay, so that means the vomiting is the action.
Yes, vomiting is the real thing of bringing out what you have loaded downloaded before now.
Balogun from Lagos, good morning.
You are welcome.
Yeah, welcome to. Good to have you on the show.
I want to ask a question from the doctor.
Please feel free.
If a person is not sleeping well in the night, what causes the health of the person?
Come again. Take the question again. If someone is not sleeping well at night.
If not sleeping at night, yes.
Okay.
I want to know what causes it.
Okay. What's responsible? Okay, I was looking at it from the other side. What could it cause in such an individual? Thank you for your question. What can be responsible? A number of factors, really. If the person has hypertension, okay, one of the few symptoms that you can find in hypertension is insomnia, inability to sleep. But that is not to say that everybody who presents with that could be having hypertension. If you're stressed up, if you have challenges that are troubling you, if you're having anxiety challenges, panic attacks, that can actually make sleep a distant friend from you. Okay? If you're sick, generally, that can also make you not to have a good sleep. Thank you very much for the question. Now, before we went on the short break, I was talking about the WASH.
Yes,
acronym.
Water access, sanitation.
Yes, water access,
sanitation,
hygiene. Thank you very much. Now, let me say this. According to the figures from WHO, more than 2 billion people drink water from fecally contaminated water sources. Fecally means stool contaminated water sources, feces contaminated water sources. So globally, more than 2 billion people. Okay, so you can see that water access is a big, big challenge. And these are areas where we need the government, yes, you can see it on the screen, where we need the government to take charge, to provide for the teeming masses clean water, potable water. And of course, 2.4 billion are without basic sanitation facilities. These figures are alarming, to say the least. 2.4 billion are without basic sanitation facilities. And this is even made worse when we have challenges like humanitarian crisis of monumental proportions that will bring about cramping people together in some refugee camps. Any little breach in the sanitary condition in such an environment will snowball into outbreak. And of course, that is part of the reason why we are seeing that in Nigeria. A number of the states that are worst hit by cholera are places where you have internally displaced people in large numbers. So water access is key. Sanitation is also key. You can see the table before us, okay? You can look at the number of people that have died. 1,178 deaths have occurred since this year began, since this particular cholera outbreak began in Nigeria. And of course, hygiene. This is the one that concerns you and I as individuals. This is the one that concerns us as individuals. We must learn to practice basic hygienic practices. Wash our hands at all times. In places or in situations where you may not be able to wash your hand, you can use hand rub or sanitizers. Okay? So washing of hands is key. Ensure that before you give anything to your children, sometimes when our parents return from a trip or from work, the children will rush to the doors to go and welcome them. And as soon as that is happening, some of us will start handing out things to children without asking them to go back and have their hands washed before coming to receive those edibles. And of course, some of them could be fruits that you may have bought on the road, maybe on the traffic while you're driving home. So there are a lot of ways through which we can get our food and water contaminated with these waterborne diseases, not just cholera. So personal hygiene is key. I'm laying emphasis on the WASH acronym because if we can institute that in our daily living in our nations, it will go a long way in preventing some of these waterborne diseases that are troubling us, some of them on seasonal basis. Okay? So I want to talk about the risk factors for cholera. Okay? Now we have said poor sanitary conditions are one of the major risk factors for cholera. Poor access to clean water, potable water, is another major risk factors. Inadequate personal hygiene can also be likened to a strong risk factor. Of course, coming down to some medical conditions, people that have reduced or absent stomach acids, usually what you have in your stomach, the medium in the stomach is acidic in nature. Okay, now people who have ulcer, peptic ulcer disease, who usually use ulcer drugs. Okay, these ulcer drugs are known to, they're called proton pump inhibitors. A good example is omeprazole. These ulcer drugs are known to decrease the acid that are found in the stomach. And if this happens, such individual could be predisposed to becoming infected with cholera and, of course, coming down with the disease. Household exposure. If you have someone around you that is stooling and vomiting that may have cholera, of course, cholera in such a situation may be a strong differential. The person may have some other diseases that can present with that picture, tuberculosis and what have you. Okay? Even COVID-19 presents with stooling and vomiting. Yes. HIV, advanced AIDS can present with stooling and vomiting. Okay, so exposure to such individuals, if they live around you or you live in the same house with such people, you must maintain universal basic precaution. Wash your hands at all times. Whenever you touch the handles, you touch the bed sheets, you help and assist in any way. Okay? There's also the last one I'd like to talk about. People who have blood group O, for reasons not yet known, are also said to be at risk of having or picking up cholera infection, okay? And lastly, if you're fond of eating raw, uncooked food, or partially cooked food, particularly seafoods, this can expose you to cholera infection. Diagnosis. How is the diagnosis of cholera made? Okay? Now, to make the diagnosis of cholera, if you have somebody who is presenting with some of these symptoms that we have outlined, okay, the diagnosis could be made in a number of ways. Stool samples from such an individual can be taken and sent to the lab. Rectal swab can also be taken. When we talk about diagnosis in COVID, we talk about nasopharyngeal swab, oropharyngeal swab, and what have you, through the mouth, through the nose. But in cholera, the swabs are taken through the anus, and that is what we refer to as rectal swab. Can be taken and sent to the lab for culture. There are also rapid diagnostics tests that can be done on the spot, okay, to actually dictate an ongoing outbreak. This is what some of the things that are being used in places where we have current active outbreaks. Okay. Now, apart from some of these test modalities that I've mentioned, I also want to point out that usually the stool, the texture and color of the stool that people who are infected with cholera passes usually is a bit different from that which you will see in some other disease condition that have similar presentation. They are like rice water. When you wash rice, the way the color of the water will look afterwards, pale, fluidy, just like that. That is how the texture of the stool looks like. And sometimes when you keep them on the bed, it keeps flowing at all times. It keeps flowing. Somebody who is infected and has severe disease can lose as much as 1 liter of fluids over a space of 1 hour. 1 liter is equivalent to 2 sachets of pure water. That is how fast the dehydration can be. And of course, if not urgently treated, if there are nothing like fluid replacement by way of ORT, by way of taking the person to the hospital and placing the person on IV fluids, such an individual can have organ damage, can go into shock, and sometimes death. Okay? At the moment, going by the last figures that we have from NCDC as of week 31, a total of 23 states have been affected by the current cholera outbreak in Nigeria. A total of 23 states have been affected, and of course, including the Federal Capital Territory. Okay? In the last week 31 that was reported, I want to read out some of the highlights. I think it was displayed a while ago. 23 states and FCT have reported suspected cholera cases in 2021. These are Benue, Delta, Zamfara, Gombe, Bayelsa, Kogi, Sokoto, Bauchi, Kano, Kaduna, Plateau, Kebbi, Cross River, Nasarawa, Niger, Jigawa, Yobe, Kwara, Adamawa, Enugu, Katsina, Borno, Taraba, and of course, FCT, and counting. And people who are infected in this place can actually move from one place to the other. Okay, so the beat goes on. So we need to be, we need to be at our best in terms of personal and community hygiene, okay, in order to beat this ongoing cholera outbreak. And of course, that is why we are hammering and creating the awareness that we need to know, so that we can know some of the things that we need to avoid in order not to get infected.
Fighting coronavirus.
Yes. Now, let's talk about complications that can arise with cholera infection. That is for people who come down with the disease. Okay?
Okay, let's take Temi Tope from Lagos. Hello, Temi Tope. Temi. Hello, Temi. It's gone? Oh, really? Okay, please try and call us back, okay? Just try, keep trying. Still on top of your #1 family entertainment channel, of course, now Health Matta with Dr. Barth and Slimy. Now there we can put this morning, still talking about the resurgence of cholera outbreaks. And of course, waiting we gas do. Before we go on that break, doctor was on complications, right?
Yes, yeah, thank you very much. Okay, so some of the complications that can arise when people come down with cholera, especially in severe conditions, include, of course, the major one is dehydration. And of course, with dehydration, you will have other things accompanying dehydration. When you have anybody that has severe dehydration in a hospital setup, the person is at risk of developing acute renal failure, now known as AKI, acute kidney injury. Okay, so that's why intervention is needed to be timely instituted to save such a person. Dehydration can, of course, cause loss of electrolytes in the body, bicarbonate, potassium, and others, which can also develop some other health challenges, including abnormal heartbeats that can be found with hypokalemia, low potassium in the body. And sometimes arrhythmias too can occur. Okay, so but let's talk about prevention. What can we do to prevent this cholera infection? Of course, we can't talk about prevention without laying emphasis on having a good access to clean water. Water access is key. And of course, sanitation is another area where we need to do more than we are currently doing. Personal and community hygiene. We must learn to wash our hands at all times. We must make sure that we drink water only from safe sources. If you can't, if you're not sure, last week someone called and then was asking the question, how safe are the pipe-borne waters that sometimes flow in some of our cities? You can actually go the extra mile of having those water collected from such areas boiled. You can actually go and collect water that is safe with an unclean container.
Yeah.
And of course, that contaminates the water and makes the water unsafe. So there's a whole lot that we need to do in terms of the water we drink. We must stick to fruits, those ones that are peelable, in quotes, those ones that you can peel yourself. Ensure that they are properly washed and then peel them yourself. Fruits and vegetables like pineapple and what have you. Okay? You must also ensure that sewages in and around your home are properly channeled into compartments. I remember some years ago when we were growing up, usually some certain time of the month, there's this group, we call them sanitary inspectors, that usually move from one home to another.
I don't think we have them anymore.
We don't have them anymore. I think we should go back, and then reintroduce some of these measures. It was helping at that time. Once you hear that the sanitary people are coming,
you tidy up, you clean everywhere.
You have to run around.
Were there repercussions?
Of course, they were. People were charged. Oftentimes, they would take some people with them, get them arrested, and probably charged to court and all that.
You do not have a choice.
Yes, we need to reintroduce such measures into our society. Okay? And then I also remember that some days are mapped out for sanitation and all whatnot. These are measures that we can
employ. Say we get time for Nigeria. For Lagos, I know say every Thursday, then they tell people make them clean up their shops. Then on Saturday, before, like you said, we always get this, whether on the last Saturday of the month, environmental in Lagos, where you cannot even travel. If they see you outside your house not cleaning, you get arrested. But I really do not, like you said, I don't know why they be stop order.
Yes, because we need to win.
Oftentimes
we don't get to do things until we are probably forced to do them, do the right things.
Yeah, right.
Okay, so such things need to be reintroduced. They were helping back in the days when we had them on. Okay, now talking about treatment. Okay, before treatment, let me go to measures that government have put in place to contain the ongoing outbreak. Okay, I'll be reading from the response activities from the NCDC portal. Okay, coordination. Response is being coordinated by the National Multi-Sectoral EOC hosted at NCDC in collaboration with Federal Ministry of Water Resources, National Primary Healthcare Development Agency, NPH, CDA, and partners. Currently, Zamfara, Kaduna, Bauchi, Plateau, FCT, Kano, Enugu, Jigawa, Niger, Gombe, Sokoto, and Katsina state-level EOCs are in response mode. Amos.
Okay, Amos from Plateau. Hello, Amos. Good morning.
Good morning.
How are you doing today?
I'm fine, thank you.
All right, good to have you on the show. Please go on with your question.
Yes, I want to appreciate the doctor in the house for doing a good job.
Thank you, sir.
My worry is, if I understand clearly, you said cholera kills even faster and much higher than the COVID.
Exactly, at least in Nigeria.
Yes.
In Nigeria, yes. So why is it that the government is paying lip service to the control and kind of cut off cholera in Nigeria as they are putting, much effort in COVID?
Thank you very much. Thank you very much for your perspective. Okay, I'm trying to read out some of the response activities that government has instituted. Okay, in trying to contain these challenges that cholera has thrown upon us as a people. Okay, yeah. Thank you very much for your question. Now, on surveillance, ongoing surveillance in all states through the routine integrated disease surveillance and response, IDSR, and events-based surveillance, EBS, have been instituted. WASH, the same WASH we talked about a while ago. Hygiene promotion, provision of safe water, water chlorination, household disinfection, and sensitization on dangers of open defecation are currently ongoing in high-risk communities by WASH sector partners and community health volunteers in the affected states. So these are some of the things that government is doing, okay, to ensure that this outbreak or outbreaks are brought to a control as soon as possible. Laboratory surveillance, supported testing of samples received from Benue, Niger, Plateau, Bauchi, Jigawa, Kaduna, Kano, and a number of other states, okay, at the National Reference Laboratory at Abuja. Okay, so they're giving backup to some other. Time was when samples for cholera, for testing of cholera, used to be transported from Nigeria to Senegal and some other African countries, but not anymore, because we have been able to make a lot of improvements along that line. Risk communications. Cholera jingles are being aired in English and local languages. Public updates on current situation and call for improved thank you. Call for improved water, sanitation and hygiene, wash infrastructures / practices issued by NCDC. Community social mobilization, distribution of information, education and communication. IEC materials and awareness campaigns are currently ongoing in the affected communities. Continued follow-up with states for updates and risk communication is also currently ongoing. But I would like to talk about the treatment. How can this cholera be treated? A good number of things can be done at the home front. If you notice that someone is stooling, regardless of what cause it could be from, you need to start doing what? Fluid replacement. It's key. And that you can do in your home by way of getting ORT or ORS sachets and mix them in appropriate ways and give to such a person who is stooling. It could be a child, it could be an adult. Now, if the person is vomiting and cannot tolerate orally, it's time to ferry such an individual to hospital as quickly as possible, because we said that the symptoms for people who get infected can start as early as 12 hours to 5 days. Okay? When the person gets to hospital, the modalities of treatment is also on fluid replacement. Such an individual could be put on intravenous infusions for proper rehydration. There are a number of intravenous infusions that we do give to people who are dehydrated when they get to hospital. Of course, their samples will be taken for tests. Cholera is a notifiable disease. I must say this at this presentation. Anybody who is attending to a patient and you suspect the person may be having cholera, just suspecting, you need to notify the appropriate authorities. I remember about 2 or 3 years ago, I had to call them in, and they came and took samples. I reassured the patient, you're not going to be moved to anywhere else. They're only coming to come and take your samples and send to the appropriate places to make the diagnosis when we had the outbreak in Lagos. Okay? And apart from that, zinc supplements can equally be given. It helps in the reduction of the stooling period, the period of time that it takes such an individual to push out the pathogens. Okay? But some of the things we must not do, particularly in children, is to give drugs that can prevent them or can stop the stooling. That can on its own, cause some other medical complications. Okay. And it's on that note that we'll be drawing the curtain.
Is it safe for us to say we are done with this topic?
Yes, because we need to attend to some other issues. I can tell you that Delta variant is truly ravaging.
So definitely, next week, we're not going to tell you guys. So
COVID-19.
Don't tell suspense.
Thank you.
Okay, we'll see you guys next week, Saturday. Thank you so much.
So until then, keep staying safe.
Yes, so please stay safe. Cholera
is
real. COVID is real.